Have you ever left a dental appointment after a simple filling or a new crown, only to feel like your teeth don't fit together anymore? Every time you close your mouth, your jaw is constantly searching for a comfortable resting place, but something always feels uneven or slightly high. You go back to your dentist. They check your bite with that colored marking paper, look at the results, and tell you that structurally your teeth are perfectly aligned, yet the discomfort completely takes over your attention. You are not imagining things. This deeply frustrating experience is a documented medical condition known as phantom bite syndrome or occlusal dysesthesia. People with this condition often feel dismissed by their doctors because the physical tests show nothing wrong. But understanding that the root cause is real and happening inside your nervous system is the first step toward actual relief. Your mouth and mind act like computer hardware and software. Teeth are the hardware. Once repaired, they are structurally perfect. The problem is the software, your brain's sensory center. In phantom bite syndrome, it glitches, continuously sending false error messages that your bite is wrong. Because your dental hardware is in perfect working order, trying to solve this by adjusting the physical teeth is like trying to fix a software virus by replacing your computer monitor. It simply won't work. The reason this glitch happens comes down to a massive communication highway called the trigeminal nerve, which directly connects your teeth to your brain. The receptors in this nerve are incredibly precise. They are sensitive enough to detect a single strand of hair caught between your teeth. Usually, this system runs quietly in the background. However, a routine dental procedure can act as a trigger. It causes the brain's sensory volume knob for these specific nerves to get dialed all the way up, and then it gets stuck at maximum. Dentists call this occlusal hyperawareness. When the volume is at maximum, it becomes biologically impossible for your brain to ignore the normal, everyday sensation of your teeth touching. Your brain is actually receiving accurate data. It knows your teeth are making contact. But because the volume is turned up so high, it misinterprets that normal contact as something entirely uncomfortable, completely uneven, and alarming. This loud sensory alarm leads to a common behavioral loop. People start checking their bite. They spend hours tapping their teeth together or subtly clenching their jaw, endlessly searching for the exact spot that feels out of place. This constant tapping actually reinforces the problem. By continuously engaging those nerves, you keep your sensory pathways on high alert, preventing your brain from ever forgetting the sensation. Everyday stress and anxiety amplify these nerve signals even further. That is exactly why your bite might feel totally fine when you wake up, but terrible by the end of a long, stressful day. This leads to the biggest trap of phantom bite syndrome, returning to the dentist and begging them to drill down the tooth or replace the crown again. When a dentist performs repeated adjustments on a healthy tooth, they are giving your hyper-alert brain a brand new set of sensations to fixate on. Instead of fixing the problem, more drilling deepens the neurological glitch. Breaking out of this syndrome requires stopping that cycle entirely. You have to consciously resist the urge to tap your teeth and decline further unnecessary dental work. It is completely reasonable to worry that something might actually be wrong with your tooth. Real physical dental complications do happen, and they require a dentist's attention. A true physical hardware problem comes with clear physical signs. You will typically experience severe, sharp pain, visible swelling in your gums, a foul taste, or symptoms of an infection like a fever. Phantom bite symptoms feel very different. They present as persistent hyperawareness, deep frustration, and a shifting sense of discomfort when your teeth meet, rather than sharp, acute pain. Once your dentist completes an exam and confirms there is no infection or structural failure, you can safely let go of the fear that your tooth is broken. You can stop worrying about the physical hardware and pivot entirely to healing your nervous system. The first step in that healing process is called information therapy. This simply means looking at the objective evidence from your dental exams, like the marking paper results, and actively reminding yourself that your teeth fit together perfectly. Next comes active defocusing. You make a conscious, daily choice to stop tapping your teeth together. Over time, reducing that physical checking allows the background noise of your mouth to fade away. If the discomfort is causing you severe anxiety, or if it lasts for more than 6 months, you can seek out an orofacial pain specialist. They focus on the software. They can provide therapies like stress management techniques or prescribe low-dose nerve-calming medications to help reset those sensory thresholds. Remember, your brain is trying to protect you. It just has its signals crossed right now. With patience, a reduction in stress, and an end to the obsessive checking, the sensory volume will eventually turn back down. To learn more about navigating this condition and to find a clear roadmap for recovery, read the comprehensive guide on phantom bite syndrome at thecalmdentist.com. Subscribe for more patient, evidence-based dental guidance. This video is for educational purposes only and does not replace a physical examination or professional medical advice from a licensed dentist or specialist.